Thank you for inviting me here to talk about drug court today. Subject very near and dear to my heart. I helped start the Manitowoc County Drug Court in 2017. Prior to that, I worked with drug courts in Outagamie County and Brown County when I was doing my clinical work. And I also did my master's research project on drug courts. So, very good program, very effective program. The presentation today is going to be talking more about the history of the program, the 10 key components that pretty much all drug courts should be following, and how we kind of integrate them. Every program is different because resources in every community is different. So Dane County may have a lot different resources than our county. So we're going to talk a little bit about what is drug court, history of drug court, the model itself, 10 key components, the old system when it comes to substance abuse and legal, the new system or what we're hopefully transitioning to, and some of the results we've seen at our 3-year mark. So what drug court is a specially designed court calendar or docket, the purpose of which are to achieve a reduction in recidivism and substance abuse among nonviolent substance abusing offenders, and to increase the offender's likelihood of successful habilitation through early, continuous, and intense judicially supervised treatment, mandatory periodic drug testing, community supervision, and use of appropriate sanctions and other rehabilitation services. Really, the focus on the drug court and when it started was the reduction in recidivism part. And they were focusing on if we can get people to discontinue use, it should theoretically correlate with a discontinuation of hopefully criminal activity. So it originated in 1989 in Miami, Florida. For those of you who remember the late 80s, early 90s down in Florida, you had a lot of cocaine use. So a number of judges got together. I believe Janet Reno was also one of the people who helped start it. They developed this in response to the prison system's inability to make long-term changes on the individual's substance use while incarcerated, and really helping answering the overcrowded prisons and ending the revolving door of the criminal justice system. The judges continued to see the same people appearing in front of them in and out, and they needed to try and figure out a way to stop that from happening. Drug courts attempt to use a therapeutic response as opposed to punitive response, which is historically what we've seen when it's come to drug abuse and crimes around that. It was designed to bring drug treatment more fully into the criminal justice system, treating the offenders with a history of drug abuse for addiction, while simultaneously ensuring supervision and sanctions when they're needed from the courts. Like I said earlier, attempt to answer the problems of overcrowding prisons, largely filling up with offenders with no other criminal history other than charges fueled by their drug addiction, and set up to address the failures in the system, such as not identifying the individuals with substance use issues and no treatment readily available for individuals when they were actually identified. Most commonly, the requirements are having a substance-related charge or established substance abuse history at the time of arrest, along with being charged with a nonviolent offense. Completions based on the participant being drug and arrest-free for a specific period of time, along with advancing through all the phases of the drug court program. And regular and frequent drug testing is involved. So the participants, while they are participating, may receive rewards or face sanctions based on their compliance with the rules of the court. Rewards could include verbal praise, gift certificates, gift cards, moving to the next level of supervision, phasing up, lunch with the judge. There's a number of different routes we go. Sanctions can include everything from verbal admonishment and writing essays to spending time in jail or being terminated from the program and facing traditional sentencing. You want to use jail as infrequently as possible. You want the jail sanctions to be generally no more than 72 hours or 3 days. Really, there's no positive movement going in jail, so we use that as rarely as possible. In order for the rewards or sanctions to be effective, they must be immediate, certain, fair, and of the appropriate intensity. Research shows long-term behavior change is most likely to happen when a combination of rewards and sanctions is used, and punishment on its own has been shown to not only be the least effective way to change a person's behavior, but it also may affect their motivation to change negatively. We've seen that for years and years and years now with the same individuals going in and out of the prison system due to their drug and alcohol use. So the 10 key components: drug court integrates alcohol and other drug treatment services with justice system case processing. Myself, I'm both the coordinator and the case manager for our program. Our clients or our participants have to be engaged in a minimum of 9 months consecutively of treatment. That includes a treatment array going from, depending if they start at residential, to IOP, to aftercare, where we use MRT or moral recognition therapy, followed by recovery management, relapse prevention, whatever you want to call. We use seeking safety. Using a non-adversarial approach, prosecution and defense counsel promote public safety while protecting participants' due process rights. Eligible participants are identified early and promptly placed in drug court. We have 50 days from the time the individual is identified to get them integrated and pled into our program. That's not a ton of time, given that the court process can sometimes drag on. There's a shortage of public defenders, so getting a person assigned a public defender can sometimes take a while. So that 50 days is a pretty quick period. Drug court provides access to a continuum of alcohol, drug, and other related treatment and rehabilitation services. So drug court is really set up to be a holistic type program. You have to address more than the alcohol and drug issue. We deal with the mental health, we deal with the life skills, we deal with financial, getting them their GED or HSED before they complete the program. Basically, any area of their life where there's a deficit or a need, we attempt to hit. Abstinence is monitored by frequent alcohol and other drug testing, including holidays, evenings, and weekends. Our program, our participants have to call a number between 2 a.m. and 8 a.m. every day, and they're told if they have to present for an observed UA, that would be between 8 a.m. and 9 a.m. They have a minimum of 2 observed UAs a week. That could go all the way up to 7. It's 365 days a year. Christmas, doesn't matter. Coordinated strategy governs drug court responses to participants' compliance. We utilize even a sanction matrix, which every participant gets at the beginning, with common infractions and what the penalty they can expect is going to be. Like if they miss their UA call in, if they miss an appointment with one of their providers, things like that. There's a set of sanctions they can expect to deal with if one of those happens. Ongoing judicial interaction with each drug court participant is essential. Best practices: the judge is supposed to attempt to average over 3 minutes with each appearing client every time they appear. Monitoring and evaluation measure the achievement of drug court goals and gauge effectiveness. So I do all the data collection, data entry, and we have quite a number of different data points that we collect and review every year or continuously. Continuing interdisciplinary education promotes effective drug court planning, implementation, and operations. Every member of the drug court team has to have 20 hours of training every year on drug court related or AODA related trainings. And forging partnerships among drug court, public agencies, and community-based organizations generates local support and enhances drug court effectiveness. This is probably one of the most valuable pieces of the programming, is those other community-based relationships that we develop, public agencies. When a person is in our program, I pretty much have a release for every single professional, personal in their life. We attack this as a team. We deal with things as a team. We keep everybody updated. Their doctors I have a release for, dentist, pretty much everything, because I want them to know what this person's going through. I explain the program to them. Allison earlier had asked questions about how much time is involved. Ours is a minimum of 40 hours a week of drug court related and recovery related activities. They have to fill out a rule of 40. They have to get those activities signed off on. And I'm able to call any of those people to verify that they signed off on them and that they actually participated. So the old system it was really treated as a criminal justice issue, punitive based, really treating individuals with substance use disorders criminals, repress them, shame them. We're going to force them into stopping, generally via confinement, arrest, convict, imprison, repeat. That's kind of the system that we watched for quite a while. The problem with that, it's ineffective. War on drugs is over 40 years old, and it's not good. Overdoses have continued to increase. We're looking at 1.7 overdoses per 100,000 people in 71. That went all the way up to 14.7 overdoses per 100,000 people in 2014. Yes, I understand in 1971, heroin was not as prominent. We did not have a lot of the same drugs and potency of the drugs, but it's still shocking. The U.S. government spent over $1.5 trillion trying to prevent people from continuing to use drugs by the use of punitive measures, not therapeutic measures. And once again, it perpetuates stigma. The person's bad. It's not the substance use disorder. So the new system, or the treatment court system, or problem-solving court system, we start looking at it as a community health issue, right? And we start doing things recovery-based. Decrease the stigma. You're a person, you have value. You're not the disorder. Dealing with the disease of addiction as a society and community, not with strictly punitive measures, right? We take a person out of their community, put them in prison or jail, take them out and expect them to act in the community as a good, productive member. Well, they don't even know how, because they haven't been in the community. So drug court allows them to remain in the community and heal, and allow the community to help them heal. Utilization of evidence-based practices. All the treatment modalities we use are evidence-based practices throughout the treatment continuum. And surround people with the support of their society and community, not isolate them from those things. Our drug court and most drug courts that I'm aware of are abstinence-based programs. It combines intense supervision. Realistically, I like to refer to it as intense support. Holistic, we wrap everything we can. We get every support we can for our clients, because just addressing the drug and alcohol problem is not going to lead to long-term change or success. Individualized treatment plans. Matching the appropriate intervention at the appropriate time and at the appropriate dosage. That is an art more than a science. Figuring out the proper sanctions, the proper incentives, what's meaningful to the client. That takes a lot of work and a lot of learning about them. Long-term evidence-based programming, including but not limited to substance abuse treatment, aftercare, relapse prevention, cognitive behavioral approaches, definitely mental health treatment. Community support meetings, AA, NA, Smart Recovery, CMA. Our program requires a minimum of 3 meetings per week throughout their full time in the program. Educational support. If they come in without their high school diploma, in order to complete our program, they have to complete their GED or HSED. We assist them in taking the test. We assist them in paying for them. We assist them with giving them a computer to use. Anything we can to make sure that they're successful at this. Vocational support. I have probably a half dozen companies in Manitowoc County that will hire our people on pretty much no questions asked. That's extremely important, because most of the people in our program's work history is poor at best, sometimes non-existent. So having these companies that are willing to take our people on without looking at those things has been a huge advantage. Life skills development, communication, financial management, transportation, cooking, nutrition, shopping, parenting, anything you can think of. If our client has a deficit in an area, I'm going to find someone to help them with it. And a system that's designed to help those with substance use disorders reconnect with the world. So this is from our program, and these percentages are based on from the time a client entered a program and moving forward compared to their whole adult life prior to entering the program. So 99% decrease in criminal cases, 99% in felony cases, 100% decrease in misdemeanor cases, criminal traffic cases, failure to appears, 99% decrease in felony charges and total misdemeanor charges. Operating after revocations, 100% decrease. Bail jumpings, 100% decrease. Traffic citations, 99% decrease. Court time has been a 98% decrease. Our county arrest, 97% decrease, and county bookings, 92% decrease.
Great. Thanks so much, Jason. Really appreciate your taking the time to go through that with us. And Joseph Gailey put one up asking about whether you have a sense of the percent of people that enter the program in your county that graduate.
Yeah, as of last September, which was our 3-year, I believe we had a 68% success rate. Understandably, small sample, because in the 3 years we've had at that point 50 clients. So I get it's a small sample, but Manitowoc County is nowhere near what Dane County is.
And this is Sheila, if I can just comment, Randall. We interact with several different drug treatment courts. Some are called recovery courts, some are wellness courts. And what you described, Jason, is our experience with all of them. They have varying levels of resources depending on funding, but the approach, the positive interaction, and our services being one of the team members for an individual, that's exactly how it functions. So thank you. This is a great presentation.
Thank you, Sheila.
You know, it's earlier in the days of drug court in different counties around Wisconsin, there was very much the idea that individuals struggling with a use disorder involving methamphetamine were so difficult to work with that they were tagged as ineligible for drug treatment court. And I'm wondering, you know, if you or others work in the area have sort of seen the needle move on that, and if the resources being brought to bear for methamphetamine use disorder, since it's so much on the rise in our area.
Well, I can tell you that there's a grant in the state of Wisconsin called the SOAR grant, which was specifically straight for opioid-related response and use. This coming year, from what I've been told, that SOAR grant funding is also going to be able to be used for methamphetamine, which is humongous because methamphetamines has taken over in our area.
So I know we don't have time to debate, but after years of working in treatment courts, I became pretty disillusioned and became kind of an opponent of the practice. And I think the decisions for a lot of people to enter treatment court is coerced, and that abstinence only treatment is not a good fit for a lot of people. I've seen it save a few people's lives, but I've seen it kill people. I've seen, it's a longer discussion that we probably don't have time for, but I guess I can't sign off without just saying that I think there's a lot of problems with the approach.
Yeah, you know, I mean, we were hearing sort of in our area practices like lower thresholds for arrest and charging of someone in the hopes that it would gain them access to drug treatment court. So yes, there's wonderful things about the model and the supervision that I think we're still learning a little bit about for whom it's the best in what circumstances.
Well, Murray's right. It's not a perfect system
Yeah.
whatsoever. No portion of what we're doing, no portion of the criminal justice system is a perfect system. So I 100% agree with him on that. We know harm reduction throughout the United States and how well it's worked in Europe is a way to go. And that is not a way that the treatment court process has caught up to yet. But by and large, in my opinion, it's still a very effective and healthy intervention. But he's right, it's not for everyone.
And keep in mind that as a provider, I'm not involved in who goes there. I'm just presented with people who are in it. And for people who are in it, we have found it can be very helpful. And we do have some success stories where we were a part of that. So